So we know that so many of you have questions about the virus, and this morning an expert is right here to answer them. Joining us right now is Dr. Arnold Baskies. He's the chairman of the Global Cancer Control Advisory Council of the American Cancer Society. Big title. He also worked with the top doc on the coronavirus task force, Dr. Anthony Fauci. So many of us have become more familiar with him in the last week. So first of all, Dr. Baskies, thank you so much for joining us this morning.
Good morning. Good morning. It's a pleasure to be here.
Thank you. And now we want to go to those questions that our viewers sent us. So we'll start with Kathleen. She asks this. My ex-husband tested positive for coronavirus today. My husband was tested today because of his own symptoms. Now, my question is, should me, my 2 daughters, and 2 grandchildren all be tested? Because we were all exposed to my ex-husband, and we all live in the same home with my current husband.
So it's a fairly complex question that Kathleen has asked. First, let me give you some background so that we can get a good answer to this question. So children can carry the virus in their secretions for an average of about 12 days. That's the bad news. The good news is that there isn't a single reported death in kids under the age of 10 anywhere in the world as yet. And most children who test positive do not show symptoms of the disease. And by the way, even though we haven't lost any children, thank God, under the age of 10 from coronavirus, we lost 140 children this past year to the flu, to put it into perspective. Now, about 8% of people in their 20s are positive. About 1 to 2% are in their teens, and about less than 1% will test positive if they're 9 years or younger. Coronavirus can live on hard surfaces for 72 hours and on textiles for 12 hours. Getting to the heart of the question, however, is these facts, and I think it's important for everybody to understand this. If you have a coronavirus patient in your household, in other words, somebody that you know has the disease, your risk of developing the infection is only about 10%. So 90% chance of not developing the infection, even if you have somebody positive in your household. Incidentally, and this is also important because this has come up a number of times, is another fact that I think should be enforced, which is that if you were only casually exposed to the virus in the workplace, for example, you weren't locked in a conference room for, let's say, 6 hours with the person who was positive, your chance of infection is only 0.5%. So being in the same household with somebody does not automatically mean that you are going to develop the disease. You only have about a 10% chance of developing that disease. So at the end of the day, should you be tested or not? The answer is, unless you have symptoms, it doesn't make a lot of sense to be tested for a whole bunch of reasons that I can go into. But it does make sense to try to quarantine that person in your house, not come in close contact with that person. Because if you do the things that we've recommended, social distancing, frequent hand washing, etc., your chances of not developing the disease is 90%. So you don't necessarily have to get tested. The answer is don't get tested unless you have symptoms at this point in time.
All right, Dr. Baskies, we just have time for one more question, at least during this segment. Can the COVID, this is Stephen, and he's asking, can the COVID-19 virus spread through a ventilation system in a building?
So I've been asked that question a number of times recently, and the answer is extremely, very, very unlikely. The current scientific consensus is that most transmission occurs via respiratory secretions, in other words, respiratory droplets, which thank goodness are heavy. So there's no mist effect. We don't know of any cases where this has been transmitted in a building, for instance, that's sharing a ventilatory system, an HVAC system. So the answer is no. And no one coughs in a mist form. They cough in droplets, which then will fall down very quickly. Coronavirus does not have wings, okay? So it's very important to remember that. Now, a fact that you should be aware of and that the listeners should be aware is that China, Singapore, and South Korea's containment efforts work because airborne transmission is a very uncommon event. the most common form of transmission is by hand-to-hand, peer-to-peer, close contact. So if we avoid that, as all the public health people have said in both New Jersey, Delaware, and Pennsylvania, we can try to flatten that curve, as Tony Fauci has said so often on television.
Right, and hopefully that works. Now, Beth Ann is asking this question, and that is, once you recover from the virus, if you do get it, can you then get it again?
Okay, so complicated question with a very simple answer. There are 4 seasonal coronaviruses that cause most of the common colds that we know. Okay, coronavirus is the COVID-19 is a member of a viral group called coronaviruses. Almost everybody has some level of antibodies to the common cold. Does that mean you can't get a cold the following year? The answer is yes. We don't know of anybody that's been infected a second time. The studies that are being discussed in the media right now are people that may have still harbored the virus after they had it the first time. So we don't know for sure, but the answer is probably unlikely. The other, by the way, the other human coronaviruses that have caused significant severe illness, like SARS and MERS, they basically, nothing is known about the possibility of reinfection with those viruses. So the fact that we don't know anything about that means that it's unlikely that we will have a problem with it a second time around next year. And hopefully by then we'll hopefully have a vaccine, by the way.
Start with Ev. She's asking, my family member has an autoimmune condition, Graves' disease. Should they be around people at work even while observing social distancing because of the exposure to the virus that stays in the air?
So autoimmune disease, first of all, it doesn't stay in the air. Let's get past that issue. It does not stay in the air. The study that everybody likes to talk about is a study where they took some coronavirus, put it in a bottle, and then spritzed it, essentially. And that isn't the way coronavirus spreads from person to person. They're droplets, not an aerosol. So people need to forget about that issue and get real about how this disease spreads. It spreads by shaking hands, getting in close contact, coughing directly onto objects or onto people that already have the problem. But social distancing works. We know that it works. It's worked in other epidemics such as this. For autoimmune diseases, yes, people are at increased risk. Do they need to get tested? No. The only people that should get tested are people who have symptoms. People who have cancer or are actively under treatment need to be particularly vigilant. People with autoimmune diseases, people who are on steroids or any kind of immunosuppressive agent, those people need to really almost quarantine themselves and stay away from anybody altogether. They're a high-risk group of people. But the aerosol thing is bogus. It's a phony study, not a phony study, but it's a study that too much has been made of already. Just remember that we don't cough in an aerosol. When we cough directly, and there are droplets. Those droplets are heavy. They don't linger in the air. They actually fall onto things that are in our environment, and that's how the disease spreads.
I'm really glad that you cleared that up because, yes, we've had so many questions about people asking just that. So so I'm glad that you cleared the air on that one.
Okay.
No pun intended.
Right.
All right, so now we're going to go to April. She says that she loves to bake. She feels fine. What are your thoughts on baking for others? It seems that this is something that she wants to do for people.
I think it's a good idea as long as she's not symptomatic. If there's any question at all, April should cook for herself and not for other people. But the chances of spreading the disease that way are very limited, unless she's coughing or actively getting droplets or doing something that would be obvious in terms of being able to spread the disease.
And this is a really interesting question here from Jane. She's asking what home health aides can do about getting personal protective equipment, because she's saying that many of them have to supply their own. There's none to be found right now. We've all heard about the shortage. And what can they do about getting tested? Because you know that a lot of them work with the elderly.
Yeah, so the PPE thing is really been a big problem for this country. We're not prepared to produce gowns and masks in the millions. It just wasn't in our vocabulary to do that. However, that is increasing as we speak. Companies have now reverted or changed over their manufacturing processes so that we can produce those in large quantities. In terms of working with older people, I would do everything that you can to make sense. If you're questionably symptomatic, do not go anywhere near a person that's elderly at all. In terms of personal protective gear or equipment, PPE, we really weren't ready as a country to have PPE for everyone. It just doesn't exist. So be patient. The help is on the way. For healthcare workers, we really want them to be the first priority for PPE because they're the people that are on the front lines of this problem. Imagine for a moment a worst case scenario where all of our primary care people, our emergency room physicians, our critical care personnel didn't have enough protective gowns and they got sick. We would really be strapped. The reason that Italy and Iran have gotten into trouble, Italy differently because they have one of the older populations in Europe. People don't realize that. The reason those countries have gotten into so much trouble is that they didn't have the resources necessary to take care of a cataclysmic event like this all at one time. We hopefully will be able to prevent that. We have PPE on the way. As a country, we are devoting resources to that. It will take time, however, to get it to everybody. But in the meantime, if you're working with older people, be extremely careful. If you have an elderly person that you're caring for, try to maintain a distance from them. If you're providing food and necessary things, yes, you have to obviously provide those things. But wear clothes that have been washed frequently, et cetera, and just do what you need to do until we can get that kind of equipment to you.
All right, Doc, one final question that we need to squeeze in. Peggy is asking, she's saying she has asthma. Should she get a pneumonia shot?
Great question. The answer is yes. She should get a pneumonia shot. She should have gotten a pneumonia shot before this outbreak occurred. She should be extremely careful. Remember, 93% of people who think they're positive for coronavirus are actually negative, okay? She is at increased risk with her asthma for the flu. She's at increased risk for developing pneumonia from other causes. But in the meantime, if she can get a pneumonia shot, I would recommend that she do that, yes.